So without further ado, let me introduce to you Dr. Jose Hidalgo. That Dr. Hidalgo is a member of the Division of Public and Community Psychiatry at Massachusetts General Hospital and Director of Psychiatry at the Suffolk County House of Correction. He has an interest in improving the care for vulnerable and marginalized populations and has developed trauma-informed programs to improve the lives of victims of human trafficking, unaccompanied migrant children, and incarcerated people. He developed a course on providing mental health care and correctional settings for psychiatrists in training. Dr. Hidalgo is board certified in general and forensic psychiatry.
Cheryl, thank you so much for the introduction and the kind invitation to speak to this group. In the context of listening to the traumatic event and also almost re-experiencing what happened, the parts of the brain that light up, the amygdala, this is the emotional part of the brain, it really gets hot and gets activated. And at the same time, what gets deactivated or becomes less active are the frontal parts of the brain, it's called the frontal cortex. So on this bottom scan here, you can see that Broca's area, the part that's responsible for producing and organizing speech, lights up. So these findings show us that a brain that is affected by PTSD is much more reflexive, so that whenever they get stimulated by something that reminds you of the trauma, it's very reactive. And the parts of the brain that are responsible for, say, organization, speech, telling stories, doesn't work as well, especially in the context of being triggered by a reminder of the trauma. Your work in terms of writing, using imagination, telling stories is really important because it's healing, because that is the part of the brain that loses its full potential in the context of PTSD.